Assalamualaikum and hello everyone. In this session, we will discuss some drugs that act on the genitourinary system. Before that, let me tell you what is genitourinary system. Basically, genitourinary system encompasses the organ of the genital, which is reproductive and urinary system. The first drug is called Roatinex. Basically, Roatinex is indicated for treating urinary tract spasm and inflammation associated with urolithiasis. Urolithiasis is actually a kidney stone. As you can see, Roatinex, it is an oral administration. Roatinex is often prescribed by a doctor in treating urinary tract stones, mild urinary tract infection, urinary tract spasms, and inflammation related to urinary stones using dissolving stones. It helps to expel stones from the patient's body. Roatinex promotes diuresis, which produces urine and relaxes urinary tract spasms, thus assisting the passage of stone. The therapeutic effect of the balanced combination of terpenes reduces urinary tract inflammation, stimulating renal blood flow through the kidney and increasing the output of the less concentrated urine. So here's the dosage and direction for use. For adult, 1 capsule to 2 capsules 3 times a day before meal. And for children, 1 capsule 2 times a day before meal. Note that Roatinex must be taken before meals. In addition, many recommendations suggest that patients drink plenty of water while taking Roatinex, specifically about 4 to 5 liters of water per day. So, the product description, as you can see, is a yellow soft gelatin capsule containing a pale yellow with a strong aromatic odor. That's all from me. Thank you.
Hi, the second drug that acts in genitourinary system is letrozole. Letrozole is used for the treatment of overactive bladder. If you have overactive bladder syndrome, you may find that you will unable to control. You need to rush to the toilet with no advance warning. Okay? Letrozole belongs to a class of medicines called antimuscarinic. It works by reducing space and relaxing the bladder muscle. Okay, you can take Genitourinary if you have an allergy, hypersensitive to tolterodine, or any of the other ingredients in the genitourinary. Also, if you are a pregnant woman, you are not allowed to take this medicine because the safety of the genitourinary during pregnancy has not yet been proven. It's better to ask your doctor or pharmacist for advice before taking any medicine. Okay. The usual dose is 1 2 mg tablet twice daily, except for people who have a kidney or a liver condition or troublesome side effect, in which case your doctor may reduce your dose to 1 mg tablet twice daily. Plus, detrositol is not recommended for children. Thank you.
I will continue the side effect of detrositol tablet. The common side effects are headache, stomach pain, constipation, and many more. This tablet need to store below 30 Celsius and keep out reach of children. Detrositol should not be disposed via wastewater or household water. This tablet look like film-coated tablet are wide around and biconvex. The active ingredient of detrositol is tolterodine tartrate and inactive ingredients are cellulose microcrystalline, calcium hydrogen phosphate dihydrate, sodium tartrate glycol, magnesium stearate, collagen, and hydrosilica. Okay, this medicine is need to be taken by oral administration. Thank you.
Hi, now I'm gonna talk about eponitrofurantoin. What are they used for? The main use of eponitrofurantoin is to treat urinary tract infections. Besides that, to prevent the infection. Urinary tract inflammation in pregnancy, nitrofurantoin is often offered as the first choice antibiotic treatment. The active ingredients dosage Each ingredient contains 50 mg to 100 mg of nitrofurantoin microcrystals as the active ingredients. Also contains lactose monohydrate, pre-gelatinized starch, titanium dioxide, and magnesium stearate. The dosage for each of the age groups: for adult, take 50 to 100 mg by orally 4 times a day. For pediatric, 1 month or older, take 5 to 7 mg per day by orally in 4 divided doses.
I will continue to talk about augmentin. First, adverse reaction: diarrhea, mucocutaneous candidiasis, nausea, and vomiting. Second, drug interaction: decreased renal tubular secretion by probenecid, increased likelihood of allergic skin reaction with allopurinol, lower estrogen reabsorption, and reduced efficacy of combined OCS, increased INR with warfarin. Storage: tablets stored in a dry place in the original packaging to protect from moisture. For augmentin tablet packs with a storage temperature up to 30 Celsius, use tablet within 40 days of opening. Augmentin tablet packs contain desiccant sachet. Do not remove or eat. Lastly, use in pregnancy and lactation. Reproduction studies in animals with orally and parenterally administered augmentin have shown no teratogenic effect. In a single study in women with preterm premature rupture of the foetal membrane, as with all medicine, use should be avoided in pregnancy, especially during the first trimester, unless considered essential by the physician. Augmentin may be administered during the period of lactation, with the expectation of the risk of sensitization associated with the excretion of trace quantities in breast milk. There are no detrimental effects for the infant.
Okay, hi. Another drug to treat genitourinary system is augmentin. Augmentin is an antibiotic and works by killing bacteria that cause infections. Generic name for augmentin is amoxicillin and clavulanic acid. The indication of augmentin: short-term treatment of upper and lower respiratory tract, skin and soft tissue, gut infections. Dosage or direction for use: tablet for adult and children is 1 tablet 3 times a day. Administration may be taken with or without food. Best taken at the start of meals for better absorption to reduce GI discomfort. Tablet may be broken in half or swallowed whole without chewing. Allergic reaction: skin rash, inflammation of blood vessel, fever, joint pain, swollen glands in the neck, armpit, or groin, swelling sometimes of the face or throat, causing difficulty in breathing. Special precautions: discontinue use if allergic reaction occurs. Avoid use if infectious mononucleosis is suspected. Overgrowth of non-susceptible organism, pseudomembranous colitis, cholestatic jaundice. Monitor prothrombin time in patients receiving anticoagulants. Maintain adequate fluid intake and urinary output during high doses. Hepatic and renal impairment: avoid use during first trimester of pregnancy. Tablet are not recommended in children less than 12 years old.
Alright, the other drug that act on the genitourinary system is avosada. As you can see, the type of drug is effervescence granules. Avosada is used for treatment of urine alkalization to relieve the painful burning symptom of urinary tract infection, relieve symptoms of difficulties in urination, enhance the action of certain antibiotics for gout, treatment of high acidity of gastric. Avosada helps to neutralize the acid in the urinary tract to assist in eliminating bacteria. Before you use avosada, when you must not to use it if you are allergic to citric acid, sodium bicarbonate, sodium citrate, sodium bicarbonate, or any other ingredient of avosada. Taking other medicines, avosoda should be avoided while taking antacid, ciprofloxacin, norfloxacin, ofloxacin, and salicylates. Direction to use avosoda: take 1 to 2 sachets 4 grams to 8 grams in a glass contain 200 ml of water, 2 to 3 times daily. Drink after the effervescence has settled down to avoid irritation. Thank you.
Things you must do when you are taking avosoda is drink plenty of water, don't delay going to the bathroom, you need to wipe from front to back after a bowel movement, while the things you must not do is not take avosoda to treat any other complaint unless your healthcare or professional tells you to do so. After that, do not give avosoda to anyone else, even if they have the same condition as you. Do not stop taking avosoda of lower for dose without checking with your healthcare or professional. Things to be careful of: if symptoms persist after the 48-hour treatment is complete, please consult your healthcare professional. Like all medicine, avosoda can cause side effects, although not everybody gets them. Taking avosoda may cause flatulence. If you notice this or any other effects, stop taking the product and tell your healthcare professional or pharmacist. Large doses of avosoda may cause diarrhea, nausea, vomiting, and azure. Storage for avosoda: store below 30 degrees Celsius. Protect from moisture. We need to keep out of the reach of children. Do not use avosoda after the expiry date, which is stated on the sachet. The expiry date refers to the last day of the month. Disposal of avosoda. Medicine should not be disposed of via wastewater or household waste. Ask your pharmacist or healthcare professional how to dispose of medicine no longer required. This measure will help to protect the environment. Thank you.